Welcome back. This is just a very brief section to complete this first lecture. What did you think about the Maguire program? What did you write down as the tactics that were used, or the arguments to try and convince you that this was going to be an effective treatment? Were you convinced? Were you skeptical? The Maguire program also has a very impressive website. This is often one strategy that should make you be somewhat cynical and ask questions. Often very professional looking websites are used. They've also, Maguire's also secured the address www.stuttering.com.au. Now what you need to know is that the program is run by other recovered stutterers, and they regularly run 4-day courses across Australia. Now another little hint as to interventions that are often trying to pull the wool over your eyes is around cost. Now the last time we looked, the cost for this course was $2,310, and they strongly encouraged participants to stay at a hotel where the course was run for about $300 a night. So it kind of makes you think there is some sort of organised system happening here, where the people who are going to benefit are not the clients but the business makers or the business owners. So as clinicians, this is all very interesting, but what do we want to know? We want to know what the evidence is. We actually want to know also what the treatment is, because you don't really get a sense of that from this program. So just to let you know, there is absolutely no scientific evidence to support this intervention. It's been suggested before but rejected by the developers, who claim that research can't quantify the intended outcomes of the program, such as attitudes to communication, attitudes to stuttering, etc. The reality is that yes, you can measure those things. Secondly, the vast majority of people who seek treatment for stuttering primarily want to stop stuttering. They don't want to just feel good about their stuttering. What we saw on this program was merely anecdotal evidence that's not necessarily representative. These types of interventions are out there, and some of your clients will want them. So, the question you need to ask yourself is, are popular therapies evidence-based? What makes them popular? Sometimes they're popular, as I said before, just because people have been using them for a long time. Sometimes it's because they're just easier or easier to do. Do all clinicians engage in evidence-based practice? Well, professionally they should, and probably many do to some degree. Hopefully more and more are engaging in evidence-based practice as all of society demands it. Why is it that well-educated clinicians implement treatments that are not supported by evidence and theory? Shane tells an interesting anecdote about a client that came into his clinic once, someone with stuttering. A 12-year-old male. He'd been stuttering since the age of 3 and had treatment on and off for the past 8 to 9 years. So this is a very entrenched problem for this boy. He had a list of treatments that he'd tried. So think about whether you think the decisions to implement these were based on research evidence. Think about what you know, or think about what is the obvious. First of all, singing-based treatment. Second, whispering techniques. Thirdly, chiropractic for back alignment. Fourth, heart medication from a pediatrician. And fifth, the Lidcombe program at the age of 12. Some of these interventions are recommended, and they're even pushed by various types of practitioners. Clients or family members often hear about them from other people who've paid money, and once you've paid money for something, you have an inherent need to see benefits. That's just a human trait. So they will convince other people that it's a really good strategy to try. They may push you to offer a treatment, or clients may push you to offer a treatment that not only has no evidence, but the evidence really screams at you that you really should not do it. And we will be talking about that more and more when we, as we go through this subject, but particularly when we talk about fads and controversies. So, without evidence, people do believe in UFOs, they believe in aliens, they believe in chakras and power bands and crystals. They're kind of interesting and they're fun. And that's okay if they stay in the interesting and the fun basket. But when they start to interfere with a person's potential for functioning in terms of speech and communication, then they are highly problematic. And you need to know how to present the evidence and work with a patient or client to understand that evidence base and to help choose the intervention path that's going to be the most appropriate for them, fit with their lifestyle, and give them the greatest potential for good outcomes. So take a moment to think about these things. Do you know of someone who doesn't believe in vaccinating their children? Do you know their reason? Because sometimes the original reason, the original research has been lost and people just get somewhat zealous about it and think that there are a whole lot of things associated with vaccination, a whole lot of long-term problems which have no basis in research or fact. Think about how you'll respond as a clinician when a family whose son you're treating for stuttering tells you that your treatment is taking too long, so they're going to sign up for the Maguire program. How are you going to deal with that? Will you know what to do when your colleagues in your multidisciplinary team ask, how do you know that what you're doing is best treatment for this adult with dysphagia? Are you going to know how to respond? Are you going to know what strategies to use? Okay, this is the end of lecture 1. I hope you've enjoyed it. I hope you've enjoyed it on an online format. And I really look forward to seeing you all in person.